Hello, my name is Barjan Carter, and I'll be doing my speech on the universal healthcare system. We all know what healthcare is. You can control a lot of things in life, but you can't control your health to a certain extent. You can make good choices or have a good diet or develop good habits that will lead to being more in control of your health. But let's say you get into an accident. In some cases, you can't always control that. Or you're an athlete, you're playing a sport and you get injured. You can't always control that. But the universal healthcare system would allow more people to capitalize on their health. What is the universal healthcare system? How does the universal healthcare system has the potential to improve and have a negative effect on the economy? Today, not only in the United States, but also globally, everywhere. Healthcare is a huge issue. Some of us approve of it, some of us don't support the idea. According to the Kaiser Family Foundation, 49% of Americans have health coverage, health insurance through their job. What about the other 51%? There's more people who don't have it than do. And this is the land of the free and equality. Everyone should be equal, and this is where the universal healthcare system comes into play. The universal healthcare system means that everyone, me, you, all of us, will have access to the health services, to any health service that we need at any time, anywhere, for little to no cost. This idea is also in contrast to the current healthcare system, which requires us to pay a portion of copay. I'm pretty sure we're all familiar with what the copay is. How does it work? The universal healthcare system can be put into many different ways. They have many different methods, but the broadest one is the balance. You have the government and you have taxpayers' dollars, and the government steps in, taxpayer. They work side by side like a little 1-2 punch. So it is required for every citizen to pay taxes. So you're probably thinking, what does taxes have to do with this? Taxes have to do with everything. It's a sole responsibility for us to pay taxes. A doctor makes 6 figures. A elementary school teacher makes maybe 30 to 40,000 a year. So regardless of the difference, both are required to pay taxes. So the same way that the government and the taxpayer dollars work side by side, the lower class, middle class, upper class have to all work side by side and pay our taxes. Both can contribute to the universal healthcare system, no matter how much you make or how little you make. So, of course, with every pro, there's normally a cons. So some of the disadvantages to this universal healthcare system, the single payer system, which means all citizens would be covered, but there would be new tax-based exceptions. This could cause limited availability of the availability to like make appointments and doctor offices to go through and healthcare wise. So of course the normal human, all humans, if something is free, we're going to capitalize on it. That's like saying gas is free, so why wouldn't you go get it? You can get it anywhere, anytime, at little to no cost. I would get gas every day just cause. Even people who don't have cars, who have bikes, would get gas just cause. So having such a large availability of healthcare at a low to no price means that the doctor offices, hospitals, clinics, whatever you name it, it is going to be full. It's going to be hard to get an appointment. What if you're desperately ill and you need medical attention? And I'm pretty sure it's going to be somebody who doesn't really need it or doesn't need it as bad, who's just going to go just because. Also, due to the pandemic, there has been a higher demand for healthcare workers. You know, the pandemic was a big nightmare in some cases. You have folks who was laid off, folks who stopped working. So now with the country slowly coming back together, it's like if this universal healthcare system is passed, we're gonna have a lot of clientele, but it might not be enough employees. But also on the flip side, a higher demand could mean more money for those healthcare workers. On the flip side though, the positives, the pros, this could lead to a longer, healthier life, a lower risk, a lower cost of the natural economy. The most striking advantage would be the power of being able to tackle the epidemic levels and help fight the chronic diseases such as cardiovascular disease and diabetes. Overall, I feel like in order to get something you never had or do something you never did, you have to sacrifice and do something you never did. Without great change, there would be no success in the struggle. So I feel like the universal healthcare system would help us all. Little to no cost for healthcare for everyone, even the poor or the people who have a lot of kids or have such debts to where they can't afford it. Thank you.